to improve the technical capabilities of supply chain professionals here in Kenya. We work mostly with the Ministry of Health, trying to improve the supply chain, and this is through the infusion of the private learnings that you get from ASCM, and also assessing their supply chain using the maturity model, as well as offering technical capabilities. So if you go to the next slide. So currently we have about 4,000 confirmed cases of COVID-19. About 1,353 people have fully recovered, and we have about 107 deaths. And this is data up to yesterday. You can see as a country, we have tested about 121,000 samples. That's quite low testing, because if you look at WHO recommendation is that for each confirmed cases, then you should have 20 to 30 tests being done. So we are talking about us being in a capacity to test 40,000 samples a day to 60,000 samples a day. But the testing that we are experiencing here in Kenya is about 3,000 tests a day. So it's a huge gap in terms of tests that we are conducting. So if you move at the next slide. So how is the current situation that we're experiencing here in Kenya? We have huge health system challenges. One, our public health sector is really wanting in terms of infrastructure. We are talking about, very poor ratio of doctor to patient ratio. It's about 1 doctor to 16,000 patients. So you can see that's a huge gap. And these doctors are the same doctors that, are covering other diseases. So with the entry of COVID-19, they are quite stretched. If you talk about the ICU beds, with Kenya, a country of about 47 million people, we only have about 518 ICU beds. So it's a huge gap. If you, in as much as most of the cases are symptomatic, we expect about 15% of the cases to be symptomatic. And if these new people need ICU beds, then we have a shortage of about 1,511 beds. We don't even want to talk about ventilators, because that's a huge gap in our public health sector. We have very few ventilators. I think the gap is about 1,600. In terms of testing, in Kenya, we have about 6,000 laboratories, but only 20 laboratories are able to conduct the PCR testing for COVID-19. So what the country has adopted is a specimen referral network. So these 20 labs act as a hub. Then samples are collected and transported to these 20 labs. What we have found challenging is that none of the courier providers, G4S, name them, is willing to sort of transport these samples. So it's quite interesting that we had to partner with the private sector. We are now using the newspaper vendor companies, because their vehicles go to some of this region to help us bring these samples to the testing facilities. So that testing is quite a problem. What happened is that there's a task force that is mandated in terms of quantification of COVID-19 commodities. And it was interesting that we did this quantification and forgot about quantifying for the sample collection kits. So the tests are there, but we now have a huge gap in terms of sample collection kit. And it's something that we have learned as supply chain professionals. Once we are doing quantification or demand planning, then you need to consider each and every aspect of the item that is going to be required. We also facing challenges in terms of PPE. I think this is a global challenge, and this was probably due to the panic buying that happened. People who are not supposed to be using N95 masks went and purchased most of all these. So our healthcare workers are quite exposed out there. Luckily, one of the solutions that we have found is our textile industry is now able to produce some of these PPEs. In terms of the face shield, we have had companies which does 3D printing. So we are closing the gaps in terms of PPE, but it's still a huge gap because we can import these PPEs from other countries. But again, there is challenges in terms of turnaround time. Late last month, the government introduced mass testing where the population was supposed to voluntarily go and get testing. But what was observed is that there was actual decrease in terms of people going for COVID-19 testing. And this is because of the stigmatization and the social hostilities that was observed. And this could be attributed to many factors. One is because once you test positive, you are taken for quarantine, and then if you become symptomatic, then you go for isolation. But you cater for all the costs. So the government is not catering for the treatment, the time you spend there in the quarantine. So that really pushed people back in terms of going for testing. So we have seen a lot of people not going for testing, and that is sort of increasing the community transmission of the disease, because we are now at the exponential phase where we are having numerous cases every day. The other thing is that people are not very sure about this disease. So even if you test positive, you go for quarantine and probably recover. When you come back to the society, they are not accepting people. People view you in a different way. So that stigmatization is really fueling the community transmission. And again, we still struggle with the comorbidity of HIV, TB, and non-communicable diseases. And actually, the fear that I have is that the next wave of the epidemic will not actually be COVID-19, but it will be about these diseases, TB, HIV, and all that, because people are fearing to go to the hospitals. They fear, they are going to get the infection from there. Kids are not being taken for vaccination. So we have seen our vaccine coverage go down from about 80% to almost 40%. So that's a huge gap that needs to be addressed. So as we look at COVID, let's not just look at COVID in isolation, but we also need to look at other diseases that continue to affect our society. Now, we know that COVID is not just a health challenge. If you go to the next slide, we still have a lot of huge economic challenge. Next slide. Tonya, if you could go to the next slide.
My laptop is not being very compliant. Okay, there we go.
Okay,
sorry.
Perfect. So we know that COVID goes beyond economic challenges. We have huge, beyond health challenges, we have huge economic challenges. Our GDP is contracting from 6.2 to 3.4, and this is very optimistic. Some economists have said that this is actually expected even go to the negative side, because even before COVID, our country was struggling with high debt rate, and the COVID situation has not made it better. Now, the inflation is increasing. In April, it stood at 5.62, and this is from 5.51. So that means that things are going to become expensive, household items, and people don't have the income to purchase some of these items. The consumer price index has increased by 0.86%. And this has pushed the cost of commodities to quite high, that most people cannot actually afford some of these household commodities, both food and non-food commodities. Our currency continues to weaken if you compare to the dollar. And this is most probably because we are net importers. So we are not getting a lot of imports coming. We also export tea and coffee because of the cessation of movement and international flights. So we are not able to export those commodities. And that means that then we are not benefiting also from issues like tourism that pump in a lot of foreign currency into our economy. Then there is reduced business output as farms are affected. We have many millions of people who have lost their jobs. And what that has happened is that the out-of-pocket expenditure for these people is quite low. So even in terms of civil unrest, we are seeing a lot of people, a lot of crime coming up. And also, if you walk on the roads, you find most people just seated there looking for jobs, because where they used to work, either they have been laid off, some people are working on half salary, some people are on half pay, and so forth. And also, we have seen businesses cut quite a huge number of people, and also they don't have the inputs because we import a lot of things from China. So that's a huge economic challenge that we are facing as a country. So if you go to the next slide, we also seen again stock out of some of the commodities, mostly the commodities that are manufactured from China. And these are things like beauty commodities, textile, mobile phone, mobile accessories. And what has happened is that then the prices of these commodities have gone up, because most of the suppliers are holding these commodities. They don't know when China is going to reopen. They don't know when the flights are going to reopen. So the few commodities that are available, then the prices have gone up. Take, for example, issues because the schools are closed. So kids are forced to do studies online. So there's a huge demand for the tablets because the kids need to access these online platforms. So what has happened is that the cost of tablet has gone from as low as from $40 to almost $150. And most of the parents cannot actually afford these tablets. So this is a huge gap in terms of we need to rethink. In as much as we say China is the factory of the world, we probably need to diversify our source for some of these commodities. Is it time to consider Africa as a manufacturing hub? Is it the time to consider other countries that we can be able to get these commodities from? So one of the suggestions that have been suggested by the government is to do price control for some of these commodities so that it becomes a regulated market. There are challenges into that, but it's just to caution the masses so that they are able to afford some of these commodities. Now, Kenya is predominantly an agriculture country. Our flower sector, our horticulture sector is operating about 30 to 40% capacity. So there have been a lot of waste of these flowers. So you find flowers are being dumped on the roadside because they cannot be exported. The farms don't have the capacity to produce as much as possible. And it's actually very interesting because COVID is not just affecting the economy, but also the environment. So what has happened of late is there has been a bit of rainfall. Now, because the flower farms and the agricultural farms are not, using the waters from the rivers, now the rivers have become full. And there has been a lot of flash flooding because now the water cannot be directed to the farms. So again, also the environment is being affected. We also produce a lot of tea. I know most of you can associate with good tea and coffee. What has happened is that the prices has crashed because we are unable to export these commodities. One, the freight cost is quite expensive for farmers to do so. So the government is also thinking of educating people to consume these commodities. Also talking to see how can we do value addition in our supply chain and probably sell these commodities in country. You find globally, like the demand for vegetables have gone up, but again, we don't have the mechanisms of exporting these commodities to Europe, to South Africa, and so forth. So the prices of some of these commodities have gone down locally, but we would have earned more if you exported these commodities. And due to the weak export, then our Kenya currency is becoming weak, and therefore we are depreciating the dollar as fast as possible. The other thing is the household and business is likely, the spending is likely to drop by 50%. So people are starting to really budget because they don't have a lot of income. And also what has happened is that there is now reduced money into circulation and out of pocket expenditure has gone really, really low. So the manufacturing sector has really been affected. I think the only sector that is doing well is our telecom, because most people are working from home. So, in terms of parties of data bundles, in terms of other parties of items associated to, working from home, that has gone up. But again, you also find that household expenses are also going up because the electricity consumption is going a little bit higher. Most people the kids are on the TV, the lights are on. So it's quite a tricky balance. So if we go on, next slide, and look on the issues of social challenges, we have had a lot of insecurity. Once, even the affluent, estates, you can't jog in the morning because you'll either be mugged. There have been a lot of shooting. So the poor people who constitute 80% of the population don't have something to eat. So they will lead you on the road so that at least they can get something to eat. And this is because of the increased loss of jobs. Again, also, if there is no construction going on, people cannot go to construction sites. So the economic activities are really affected. We also have an increase in civil unrest because of the lockdown. The lockdown has been revised a bit. It's now from 9 p.m. up to 5 a.m. But people are not used, to staying at home. So there has been an increase in breakages for homes, and also an increase in terms of people wanting to, everybody is singing, we want the economy to be reopened. So that is pushing people to the streets. A lot of police brutality when they find you out, outside the time that has been stipulated. Again, an increase in gender-based violence. I think because of the people haven't learned to stay at home with their family, issues of mental health. So I think the next wave is how are these issues going to be addressed even after COVID, if it's going to get away. So it's not just the health issues, not just the economic issues, but you can look also at the social challenges. So if you move forward, so how are we coping with this situation? We know that our testing is wanting. We are actually just at 0.1% if you take the total population, and we need to be at 10% to see the spread of the disease. So what the government is doing is we are not actually calling it mass testing, but targeted testing. So if you get positive cases, then you test people around there. We also test in our healthcare workers and other people who are offering essential services. And also the government is emphasizing on other methods, physical barriers. It's not working very well because most of our people live in informal sector. So telling them to have social barriers is becoming a problem. For example, the hotels are not open for sitting, but you can go and order and eat from home. Some hotels now have just opened for sitting, but they are not selling alcohol. So what people are doing is, because they want their alcohol, is you go to the hotel, just order 1 or 2 sausages and order 3 beers. So we need to change the mind of the people so that they see the essence and seek health behavior. Again, there is an emphasis on universal masking, but you have to be cognizant that the supply chains for masks has been really affected. Behavior change, people need to seek health services. And also the country has just introduced home-based care for asymptomatic COVID-19 patients. We don't know how that is going to work because most houses have 1 or 2 rooms. So if you want to isolate the patient, then it becomes a challenge. I think businesses must learn to adapt in terms of their capacity, in terms of their cost, in terms of their infrastructure. The businesses have to learn to evaluate what are the critical tasks and who is going to offer this critical task and what workforce capacity do we need, to survive. In terms of cost, there has to be reallocation issues to do with travel, workshops, some of the trainings. So these costs have to be reallocated to the critical task. Businesses also need to rethink about the policies of paid and unpaid leave. Most people have already exhausted the unpaid leave. So do you let them go? Do you just give them half pay to sustain them? Is it the right time to release new projects? And again, also in terms of capacity and idle employees, just to think about policies we can come up with. Again, businesses have to adapt in terms of connection, IT infrastructure, because people are working from home. So do you give them allowances to buy airtime and so forth? How do you motivate your employees and keep them engaged? How do you also promote well-being? Just talking to your employees, assuring them that we are in this together. We know that the workload is low, but you can do X, Y, Z. And also businesses need to plan for absenteeism because people have various challenges. And lastly, if you go to the last slide, the next slide, which is the last one. We also need to introduce the right economic policies to revive the economy. We have had stimulus package injected, but unfortunately, this was injected in the formal sector, tax reliefs, but most people are in the informal sector. So making sure that we have the right economic policy. We need to conduct a proper review and assessment of our businesses. And we are looking at issues to say which processes are absolutely vital for continuity, what's the availability of input and resources we need to execute these critical processes. Can we find alternative ways to execute any of these risk processes? We need to revise and review our cash flow practices and take measures to ensure survival of business in low business environment. We also need to, probably the government could invoke some of these price control of essential goods so that we protect the masses from escalation of prices. And also look at our supply chain and diversify the source. I think I'll stop there. I just wanted to highlight some of the situation and the challenges we are facing here in Kenya. So thank you very much.
Thank you very much, Eric, for that information and sharing what's going on in Kenya. I think that from a South African point of view, there are a lot of similarities in where we are. We share the same sort of challenges. One of the things, just going back to the president's address last night, where he was giving us an update on our different on our current situation. So I'm not sure, and I don't know if anybody else is, whether we've moved from a phase 3 lockdown to level 2. It kind of was a bit of a confusing message, but one of the things that came out strongly, and I see that it's an issue there as well, is alcohol. So while there was no alcohol, there was a lot less road accidents, there were a lot less casualties in the hospital of people shooting each other, stabbing each other and whatnot. And those sort of things have gone up exponentially because of alcohol. So they've reintroduced it, but only during certain times. I think it's Monday to Thursday you can buy alcohol during the day. Gender-based violence, another thing that came out strongly during the president's address last night. That has risen enormously. And obviously it's a problem that we have in South Africa. I don't know if it's a common problem in Kenya, but certainly from a South African point of view, it's on the rise, and it seems to be getting just a little bit out of control. One of the things that surprises me, and I don't know if anybody else can comment on this, is the stigma of having COVID-19. So I'm not aware, and I mean, I don't know. So I'm not aware that that's a problem in South Africa. But maybe somebody can share some insights on that, because maybe it is an issue. I'm just not aware of it.
Tanya, it is an issue depending on your social background. So in the more uneducated communities and so on, there's a massive fear and understanding there. So if someone is COVID positive, it's being hidden, because similar to the initial stages when people were HIV positive, they didn't know how to deal with it, and they are fearful of contagion and so on. So it is having an effect. And we are seeing it at the worker level in warehouses. So if someone who's a worker in a warehouse at that level, if they're identified, is some sort of effect socially coming through. I mean, in the normal communities over here, we know of people and people's friends and so on who have had it and have so-called been cured, and there's no ramifications to them. There's no stigma to them. But you're seeing it at a lower level. And I think that's what Eric was alluding to in Kenya, since you have quite a big informal sector of the market there, and people work on emotions and possibly bad press and bad knowledge of what's happening.
Yeah, it's definitely, and I think it's the fear of the unknown. So like you say, where they're not necessarily educated and they don't have access to the information that we do, it is the fear of the unknown. What does it mean? They hear about people dying. They don't necessarily know how many people are dying. I mean, and the fact that they have to, am I right, Eric, in saying that they have to cover their own costs for quarantine? Is that just in terms of taking time out of work, or paying to stay somewhere for quarantine?
So what is usually happening is the quarantine is either happening in schools or in hotels or in colleges. So once you go in there, you need to eat. There's a daily charge of about $20 to $30 a day because they need to feed you, you need blankets and so forth. So by the time, it's a minimum of 14 days, but if anybody tests positive in the quarantine facility, then that is extended by another 14 days. So when you're checking out of quarantine, you're slapped with a bill of about, let's say, $950. So it becomes a big challenge because you had not planned for that money and the government is not taking care of that. So that is really stigmatizing people. And that's why they're fearing to go for testing, because if I test positive and I go for quarantine, there's this cost. If I'm taken to a health facility, even the treatment cost is on myself. So that's a huge gap that the citizens have raised to the government.
Eric, if I could ask you, as a result of that, are you therefore suspecting that there's a much bigger incidence of COVID-19 in the population than what's reported, and with higher death rates because people just aren't being tested, aren't in quarantine, and aren't in hospitals?
That's very true. I highly suspect the numbers we are getting daily is not a true representative of the caseload in the community. So one of the things is the government is trying to educate people, go out there for testing so that we know the correct numbers that we have. So it's highly likely that we are getting low numbers. We have had a number of deaths happening where they are masked. It's death from other diseases, but we also suspect could be about COVID-19.
I mean, the numbers of cases that you've got and the numbers of testing that you've done, I think compared to us, your numbers are very low considering your population size is the same. So there's probably a lot more people running around with COVID. And I mean, you can't blame them. I mean, if there's a stigma attached to it and then you get slapped with a bull at the end of it because you're unfortunate enough to get COVID-19, that's really a really not a great model to work with. So I don't know how, I mean, as far as I know in South Africa, you don't pay if you are put in quarantine, or am I wrong? Am I totally out of reality with that one? Does anybody have any insights on that sort of stuff here?
I was under the impression that the quarantine is a self-quarantine. The people I know are put in quarantine, the returning people that have returned and gone into quarantine, the government has paid for that quarantine. So that I do know about. The government paid for that. I don't know what they do if they test you positive. They take you isolate yourself at home. So the only time, and then if you go to a health facility and go to doctors, I'm assuming those costs are dependent on whether you're on medical aid, on private medical aid, or whether you're at government hospitals and under the normal healthcare that we will be experiencing under NHI in the future in this country.
No, that's really not. I'm just looking in terms of government funding. So you did say that there was some government funding for the formal sector, if I'm correct. Have they done anything to support the SMMEs, sort of smaller businesses with funding to keep them running, to keep them going?
Thanks, Tanya, for that question. Yes, last month the president announced what is economic stimulus package, and this was targeting the SMEs. So there's a fund that has been set up apart, and SMEs can apply. There are conditions that have been put in place. So SMEs can apply for, loans so that they keep their business afloat. The banks have also issued a moratorium for loans, that were effective before March 19 when it reported COVID. I think it's 1 year. So within 1 year, your loan will not attract interest, so that you are able to pay after the situation normalizes. For the informal sector, I think for those people who are earning less than $200, then they are now exempted from tax. So that is also sort of in people, so that they don't have to pay a lot of tax. And other measures for people in the informal sector, they have a cash transfer system where people get some cash every week to buy the commodities they need, and also some food distribution.
Okay. So it's very much a similar type of model to what we've got going here. Was your lockdown done in phases? So like we've got a level, it goes from level 1 to 5, and there are different activities and things that you are allowed to do and can't do within the different phases. Have you worked on a similar sort of approach?
So it's quite interesting, because here we don't have a lockdown per se. So what we have is a cessation of movement. So the epicenter of COVID is mostly in the urban cities, that is Nairobi and in Mombasa. So what they did is that you can't move in and out of Nairobi up to July 7th. So if you are in Nairobi by the time the president announced the cessation of movement, you stay there, so you can move in and out. And the same case with Mombasa. But countrywide, what has been introduced is a curfew. Initially it started 7, no moving out of your house. You should be get outside, 7 p.m. to 5 a.m. in the morning. But there's no complete lockdown of the places.
Okay, so we had level 4 lockdown from I think 8 p.m. to 5 a.m. We were given exercise times from 6 a.m. to 9 a.m. in the morning, and it was bizarre. I mean, there were cases of some poor guys that were surfing that they wanted to arrest because they were on a lonely beach where there was nobody around. So I think the implementation of it has been very skewed in terms of where they're enforcing it and how hard they're enforcing it. I mean, I'm sure you know that we've had incidences of police brutality. They brought in the South African National Defence Force to help enforce lockdown, and there were a number of cases of brutality there. In fact, there was a guy that was murdered by the SANDF. I mean, you can't say it in another way than he was murdered. So, I mean, how many more cases like that? I don't know. So, yeah, it's far-reaching. Yeah. But I think in terms of countries, we have many similarities and much the same challenges as what you do.
Yeah, and also, if you look at that cessation of movement, it's still affecting the supply chain, because most of the urban centers or most of the urban areas, we don't produce a lot of food stuff. So this food stuff comes from the rural areas. So what you find is that because there's no vehicles that are coming from the rural areas to, let's say, for example, Nairobi, the costs of food stuff in Nairobi has really skyrocketed. Because unless you use a courier company to bring, let's say, potatoes or to bring cabbages from the rural region to Nairobi. So that is also affecting the supply chain. There are people who stay in the rural areas and come to work in the urban regions, so they can't access their workplaces. Again, they have to be rid of. So it's a whole reorganization of the supply chain.
I mean, obviously our supply chain has been affected, but I definitely don't think to that extent. I stand to be corrected, but as far as I know, we are still getting fruit, veg, food. I mean, granted, the food prices have gone up, everything's gone up, but we had a discussion 2 weeks ago about the transport, logistics, and distribution costs, and how that's been affected and impacted because of COVID-19. So, you know, your shipping, your containers are stuck out in the ports, and every day it's out there, you pay more money, and there's a backlog, and it's not. I mean, it's your issue as importer. It's your issue, so you pay those costs. The containers, you have to pay for the container as well. You are looking at airfares that have gone up. I don't know. I think it was something like 8 or 10-fold, because there's not enough cargo flights going out. There's not enough space to move goods, so those flights have that has gone up. So everything's gone up highly. I mean, so yeah.
Tanya, it sounds like we are a little bit luckier in the sense that we had this. Not everything was perfect, but we did have this qualification of an essential service. So all transporters were able to get essential service permits. So during even level 5, which is the strictest lockdown, trucks were able to move as essential services, as long as at that stage they were moving what was called essential products. So they couldn't move clothing, but they could move foodstuffs, and they couldn't move alcohol and cigarettes, but they could move pharmaceuticals. Okay, in terms of our supply chain. Eric, our heart is close to Kenya because as consultants, our company's been working for the last 18 months in Kenya. So we've been held up on a big project with Twiga Foods that we haven't been able to complete and execute since the lockdown. Mm-hmm. So we would have been there in Kenya at this time, busy completing a project there. And it's very interesting to hear your insights and your issues. Obviously, we're involved in a food company there, and they have been able to manage their food supply to the markets. They service the informal market. The problem is a lot of their informal traders have just packed up and gone and aren't selling. So their exit of their product doesn't exist, and that's one of the things that has affected them. So they've had about, I can't remember the percentage, probably 60–70% drop in their customer demand through what is their access to the market. Now, when you spoke about the government grant to small SMEs. Would that be defined as those traders that sit in informal little huts on the side of the road selling fruit and veg? Would they be classified as the small SME in Kenya?
Not really, because again, we don't have a database of those informal people, who sell things on the side of the road, and it will be a little bit of a challenge on disbursement of this money because most of them don't have a bank account. So that's the challenge. But SME, they have establishment on where the money can be wired or how they can access the money. So what is happening for those people who sell food stuff or things on the roadside is they get the weekly sort of allowances or money to buy, just to maintain them and buy food for their family. Again, in terms of truck drivers, we have services that have been categorized as essential services. Mm-hmm. For example, truck drivers who are transporting maize and food stuff. But if you are crossing if you are saying getting maize from Tanzania to Kenya, before you enter Tanzania, you need to go with a COVID certificate to show that you are COVID negative. So because of our wanting testing, you find that the backlog of trucks on the roads is like 70 kilometers as drivers, camp there waiting for the test results to be wired, and therefore they get a certificate before they cross to another country. Or if they had product that they were bringing in, therefore some of these perishable goods, spoil.
Yeah, I actually saw a picture of that where trucks were queued for kilometers.
Yes.
Trying to get through. It's absolutely crazy. Is there anybody else with any other questions, comments, thoughts, inputs on what Eric has been talking about, how it relates to Africa?
I can see Glenda's hands is up.
I think Glenda's hand was up from just now.
No, Eric, I put a question in the chat box. I want to know,
okay.
Professional, is there any work that you're doing in Kenya to assist your country? Is there, I think we have similar challenges between Kenya and South Africa and similar solutions. But I was more interested as to, even if it's not you, what are supply chain professionals doing? What's the supply chain community doing in Kenya? Is there anything that we as a supply chain community in South Africa can learn from Kenya? So I'm kind of like a solutions person.
All right, thank you, Glenda, for that. Yes, there's a lot that the supply chain professionals are doing. So when we first announced the first case of COVID-19 in March, a task force was formed to look at the country preparedness and response measures in place. So there's one that was looking on the policies. Another task force was looking at resource mobilization and all that. And in the resource mobilization, one of the tasks that that committee was mandated to do is to quantify for COVID-19 response commodities. And this is where the supply chain professionals came in. Myself and other people were sitting in that committee, and we helped the government to quantify for testing kits, to quantify for isolation beds, to quantify for PPEs and all that. So using our knowledge on quantification, we were able to help the government in that. So we did that. We submitted the budget to the Ministry of Health and the quantities required. But then another challenge came when the commodities came into the country. They were distributed to the testing facilities and all that, but there was no mechanism of tracking the consumption of those commodities, so that we say X amount has been consumed in this facility, and this is the stock on hand. So we also helped the government to design a simple Excel tool that they can help in terms of reporting and tracking of these commodities.
Okay.
Other than that, there have been, webinars, training on good practices in supply chain.
Did you guys as supply chain professionals approach government yourself, or were you called upon by, because what's happening now with COVID-19 is that it's all supply chain related. So again, for me, I don't understand how come our government's not calling on us? I'm just like, how did you guys come about sitting on a task force for Ministry of Health?
So you find like, I think the government first instance was, this is a health problem. So once they were faced with the supply chain problem, that's when they sort of try to see where can we get help. But what I found is it's most of the supply chain professionals approaching the government and say, this is the support that we can offer. This is what we can offer. And this is the solution that we can provide for you. Because the government has not really elevated supply chain here in Kenya to that level that they would think of them at the first instance.
Okay, thanks for that, Eric. Because my plan as a supply chain professional is actually to send a letter to the Ministry of Health of South Africa and say, hey, I'm a citizen of this country, I've got certain skills, I'm not going to charge you for it, but let's help wherever we can.
Yeah.
Thanks for that.
I
I
think
also
that,
see
sorry,
there was a
Eric.
comment from Cobus in the chat
Yes.
about COVID-19 impact on importation of other medicine and locally available in Kenya. Yeah, we have had stock out of some of the medicine. You know, most of the API for the production of medicine is either in China or is in Japan. So with the lockdown in China, then we faced stock out of some of these medicine. But what has also happened is that those medicines that can be manufactured locally by the local manufacturers, then they had to ramp up their capacity to produce this medicine. And the government has sort of given funding to the local manufacturers of pharmaceutical supplies to improve their capacity.
Just on the supply chain professional thing. So the minute COVID-19 hit, everybody was spinning, and suddenly supply chain management was front and center, and it was everything to everybody. Before they recognized supply chain, everybody was rushing out to buy toilet paper. I don't know if you had a shortage of toilet paper, but everybody rushed out to buy toilet paper and things like that because they were worried that they wouldn't be able to get it. So obviously their faith in supply chain, I mean, they don't even know what supply chain is, but their belief is that they wouldn't be able to get the things. And there's certainly a lot more hype about supply chain management. Everything you read now is about supply chain management. So one would have hoped that the profession as such would have been elevated because of that and have gotten more recognition. I know that, I mean, in Kenya, is supply chain management a recognized profession? Can you be a recognized supply chain professional? Is there any such thing in Kenya?
Thanks, Tonya, for that. I think I was one of the person who rushed to the supermarket to buy toilet paper because I hadn't thought and hand sanitizer. So I'm stuck with boxes and boxes of hand sanitizer. I had to donate some. Supply chain professionals are not very recognized here in Kenya. It's something that is coming up. We had heard people, for example, in the health sector, we have, if you're a pharmacist, then automatically you get posted to manage the pharmaceutical supply chain because they believe that the pharmaceutical supply chain can only be managed by a pharmacist. So, but we are seeing a change, a shift in that. We have now bodies, local bodies of supply chain professionals who are trying to popularize and educate the employers that this is a critical expertise that you need in your team. So it's coming up slowly, and we have seen now, people embracing supply chain professionals.
It's good to hear that it's finally being elevated and recognized as a profession, and a great profession to be in. In terms of, so let me think. So in South Africa, and it's possibly the same in Kenya. In South Africa, and we digress from the COVID thing, but we have a situation where supply chain management is perceived very differently in public sector from that in private sector. So when government talk about supply chain management, they talk about procurement and purchasing. And we talk about,
they talk about fraud and corruption.
No, they don't talk about it. They hide it, keep it under the carpet. So I mean, do you have that same challenge in Kenya? Yeah, I mean, or do they recognize supply chain management for what it is in the public sector from an end-to-end perspective?
It's actually the same problem we are facing here in Kenya. When in the public sector, when you talk about supply chain, everybody talks about procurement. And most of it, I think, is because of where we are coming from. We have SIPs here in a Certified Institute of Procurement Services or something like that. So most people have done that as their supply chain courses, and it's heavy on procurement. So you find that most people take supply chain and equate it to procurement. In my previous employment in the public sector, I was working for an NGO and we needed supply chain officers, public health supply chain analysts or officers. And we had an advert out there for people to apply for that. And I would say that 90% of the applications we got, most people had, diploma or degree in procurement only. So it's like people then confuse that and say this could be a procurement job.
Okay, it's good to hear we're not the only ones facing that challenge here in South Africa. And it's, we've been working with the National Treasury in terms of this interim Council for Supply Chain Management that they're wanting to put together. And we've been sitting on this council for 2 years, and they still do not understand the difference between procurement, purchasing, and supply chain management. And for me, I just they constantly just carry on confusing everybody as to what it is. But hopefully we will be able to change that from a SAPIC's perspective through the professionalization of supply chain management. It's a very exciting project, and it is ready to hit out there soon. And hopefully we can get you guys from Kenya involved. So if you don't have a body like a SAPICS there, then we definitely encourage you to reach out and get people to sign up with us, attend our events, especially if they're virtual. There's no stopping them. And I think we've got a lot of really good content. I think that from pockets of excellence, we've got some incredibly skilled people, knowledgeable people. We are at the forefront of certain things. Just because we're in Africa doesn't mean that we're backwards. And I think that's a lot of perception globally, but that's not the case. And I know of really, really good projects that are happening in different countries throughout Africa. And I'm sure that you are aware of them. But so I think that's me. Does anybody else have any? Because I just feel like I'm talking and talking.
Tonya.
Yes.
Tonya, Kobus here.
Yes.
I think you know me a little bit by now, so let me become a bit political. I think in South Africa, from just reading the media, and also some other insight that I have outside the mainstream media, I believe that the government of South Africa, first, they don't always trust private organizations. They feel threatened. They're also concerned that they might lose control because ever since the beginning of COVID-19, March 2020 here in South Africa, if you look at the whole lockdown process, the control aspect has become a huge priority within government. And if you look at what happens, let's say if you go to a civilized area or suburb, people mostly adhere to the lockdown rules and regulations. When you go to the townships, it's a total different story. They carry on if life is still fine. And sadly, it has led to the death of some people. And yeah, that's just my take on it. I think there's a huge gap between the public and the private sector when it comes to trust in certain areas. For us as supply chain individuals, it might be even more, because I think you mentioned that the government sees supply chain management as buying a pen or ordering a book or two. It's all for them about procurement. They forget about transport and warehousing, imports and exports, air freight, sea freight, I can name it. So the education on that side, and I don't know if we will breach that gap in my lifetime, is to educate government and say to them, listen, here we are. You're sitting with a a pool of people in the private sector that can really assist, especially during crises like the COVID-19. And they're missing the boat totally, absolutely. That's just my take on it.
No, they are, and being part of this council, we were privy to a report that was produced based on the study of a number of municipalities and supply chain skills, and they are at best minimal. And I mean, we are talking procurement, purchasing, we're not talking end-to-end supply chain. So their knowledge is not even there. So I just want to mention as well, because Eric is with ASCM, the Association for Supply Chain Management. You can reach out to them through SAPIX. We are their elite premier channel partner here in South Africa. So they've also got some incredible resources that you can tap into. That's available. I feel like I need to stop talking and somebody else needs to talk.
Anya, thank you for arranging this. I just want to thank you. I've got to run off to another Teams meeting, but thanks, and it was most informative. And Eric, thank you for presenting. And maybe when we can get back to Kenya one day, we can catch up for a coffee.
Sure, you're welcome anytime. Thank you so much.
Cheers.
Thank you, Gary.
Thank you, Eric.
Okay, so if there were no more comments or questions or suggestions, I will start wrapping up in terms of the session. If I can, I always want to go back to the what have you learned today, because I think that's important. If we are, oh dear, I'm disappearing here. Every day we need to learn something more. And have you learned something today? And if you have, what is it? Share it on our LinkedIn page.
Yeah, Tanya, just from my side, I think what I've learned about Eric's situation in Kenya is that there's a lot of similarities.
Yes.
There are also differences though. I actually, look, I'm not too involved in these things at the moment, so it's difficult for me to really comment. I just feel that countries across the board, especially in Africa, could have done more to assist each other. They are at the moment so focused on their own crisis that we might miss the plot in the end. We're all part of the same continent.
No, indeed. And I think as South Africans, we need, as Africans, we need to collaborate more, and we need to share more and work together. You're definitely right in that. I think we do share a lot of the same challenges, a lot of the same problems, and we could benefit greatly by more interaction, more sharing, more collaboration. I think this new normal or new world we find ourselves in, collaboration is going to definitely be the order of the day. And the more we can do of that, the better. Just in terms of upcoming events, and this is the for this week, our virtual event next week on Tuesday the 23rd. We are incredibly excited. We've been doing lots of webinars and community connect sessions and the like. So this is going to be our first run at a full day. We've got a really, really good lineup of speakers, exceptional speakers. And I think that if you haven't registered yet, you certainly should do. The cost is, I mean, for what you're getting is to my mind, you're not going to get better value for money. And the benefit of this is that if you have a challenge at work or you have a crisis, you know, you can pop out and attend to it and pop back in whenever you need to. So I would encourage you to visit the SAPIX website and register for that if you have not done so already. And I think that just about sums it up from me. So thank you all for joining us. I hope that the session was informative and that you all learned something. And we look forward to seeing you all again next week. Eric, thank you for your time And thank you for your valuable contribution to the session.
Thanks, everybody. It was an honor interacting with all of you.
Thank you.
Come back soon.
Yes.
Thank you.
Thank you.
Thank you.
Until next week.
I'll see you all next week, hopefully.
Yes.
Thanks, Tonya.
Sure. Thanks, everybody.
Take
Bye-bye.
care.